We are all looking to turn back the hands of time, or at the very least, slow down the aging process. Today, we are talking to a leader in the anti-aging revolution, Dr. Dean Silver from Integrative Cardiology and Preventative Medicine. You are here. You are a cardiologist. You are also board certified in internal and anti-aging medicine. Great to have you along. You also cured yourself of cancer. How did you do that?
Yes, thank you for having me. 12 years ago, I had a cancer in my chest, and I decided not to do chemoradiation, and I learned about detoxification and wellness, and I'm cancer-free.
And we're all getting older by the day. What are some reasons that you feel we are aging more rapidly?
The reason we're aging is a concept called free radicals, hormone imbalance, inflammation, and lack of detoxification, and these are things that I focus in the office. I do natural hormone balance and detox. I think it's very, very important.
And you know, so many of us, it's really difficult to talk to anybody these days who isn't directly affected by cancer or has a loved one or friend affected by cancer. What are the best ways, do you think, to measure your hormones and to find out if you are making cancer estrogen?
Well, estrogen is, in some people, carcinogenic, and we can determine that with a urine test. So when you collect your urine, we can actually see if you're making the cancer that causes estrogen. I received that bad estrogen from my mother. That affected my prostate, and I passed that on to my child that already has breast biopsies at the age of 30. So we do a 24-hour urine to look for this bad estrogen, then we manipulate it. So let the viewers beware that estrogen's a double-edged sword, and I think this should be measured in every woman.
And we're going to look at some slides that you have provided us. These are real patients, and this is what we're looking at. You said it's a normal study. What are we seeing here?
Yes, this is an infrared camera called breast thermography, which is approved by the FDA back in 1982, which has a sensitivity of 97% to pick up breast cancer. The image is showing the left and right breast, and that blue pattern is normal. So this would be a normal patient.
So what's the difference between a thermography versus a mammography?
Thermography is basically looking at heat. Mammography is looking at calcium. By the time you've seen cancer on mammography, it's been there for probably 8 to 10 years. So thermography, looking at heat patterns and blood vessel flow, is looking at early studies.
And the graphic we were just looking at, that was a fibrocystic breast that we were seeing there?
Yes, you can note there's variated colors there, and I then performed an MRI, which is compatible with fibrocystic breast, and we now know that a certain number of people with lumps and bumps in their breast do go on to breast cancer. So this is an excellent, non-invasive, non-radiation, no-contact screening test.
And a ruptured implant would look like that.
You can see on the left-hand side of the viewers, there's a multicolored, and I then performed an MRI, which also showed an implant. The other breast, which is blue, was normal.
And then breast cancer looks like this.
Yes, it looks like that. That's a patient that was sent to me. The area of the red was a big stage 4 cancer. There's evidence of metastasis or spread under her armpit as well as her lung. And unfortunately, she died. She was a nurse.
Oh, I'm so sad to hear that. Is there a test that we can do to detect to see if we have cancer?
Yes, there's a myriad of different tests. There's gene tests that we can look at. There's a test to see if there's cancer circulating in your bloodstream. It's called circulating tumor cell analysis. And I'm now doing chemosensitivity testing to find out which chemo is right for you.
And I know you're going to come back and talk about a new science called metabolic oncology, and we will get to that in a couple of weeks in the next segment. Dr. Silver, we appreciate you being here, and he does have a very special offer for all of our Sonoran Living Live viewers. You will get $100 off a breast thermography. That is a special price of $199. The regular price is $300. If you would like to make an appointment at Integrative Cardiology and Preventative Medicine Center, call 480-860-2030. Their office is located at 10,900 North Scottsdale Road, and you can also find them online at deansilvermd.com. Dr. Silver, thanks for being here.
Thank you for having me.